Welcome back to Seniors in Action. I'm Michael Scott. I know it's been a while since I've done a video. I am a CPA and it's been tax season, but other than that, I need to get back with it, that's for sure, and do a lot more videos on this channel. But so today I want to talk about something that's a little more sensitive, and that is options for erectile dysfunction. And this affects a lot of us senior citizens. They say 18 million men are affected by this, and of course 18 million women then are affected as well by it. So not a pretty thing to talk about, sometimes an embarrassing thing to talk about, but let's get into it. So we have our normal disclaimer here for affiliate websites, affiliate marketing. If we make any money off this channel, this just says, hey, we get a little commission off it if you buy anything. And I don't think I've got anything right now that you can actually buy from here. But also a medical disclaimer. I'm not a doctor. I'm not a medical professional. Be aware of that. I do have a brain, though, and I can read, and I understand the English language, and so I can do a little bit of research, and so I do have experience in this area. I'm 72 years old, and unfortunately I have more experience in this area than what I want. So it's anyway, that's the medical disclaimer. I'm not a doctor or a medical professional. With that in mind, let's talk about some of the causes of erectile dysfunction. And this is basically from the Mayo Clinic's website. A lot of different causes: heart disease, clogged blood vessels, high cholesterol, high blood pressure, you name it. I mean, diabetes, sleep disorders like sleep apnea, alcoholism, some medications, diseases certainly like prostate cancer and those type of things, and surgeries for prostate cancer can cause this as well. But a lot of times as we age, it's just caused by aging, and some of that is probably by restricted blood vessels and that type of thing as we age. But a lot of things can cause it, and whatever causes it, you need to know how to fix it. We are seniors in action. We want to fix these things if we can. So let's talk about some psychological things that might cause this. This is also the Mayo Clinic, and depression, anxiety, stress, relationship problems. It reminds me of the old country western song that I don't want to kiss the lips of the woman who chews my butt all day long, or something like that. And so certainly relationship problems can cause something like this. But options. And I'm not saying a lot here on the slides about options, but let's talk about them. Natural remedies. There are hundreds of natural remedies out there. People trying to sell you all the time on this, from things like low testosterone to tension rings to capsules that are supposed to increase your libido, or all sorts of things. And some of them work. Well, some of them may work for some people. I don't know. I haven't, in my experience, I haven't seen any of them work very good. But it depends on how far gone you are in this area, I think. So the oral medications, that's things like Viagra, Cialis, Levitra, some of the medicines that are on the market, and there are a lot of them. The drawbacks are that these are they are expensive, and they cause headaches, they cause congestion, and you have to wait half hour or an hour after taking them. And so there are some drawbacks to these things. And you may come to a point where these things don't work anymore. They may have worked for a couple of years, but they don't work anymore. And so if they don't work anymore, then what is your option? And I'm just here to tell you that there are some options available to you, but injections would be one option. Boy, that sounds like fun, doesn't it? I am diabetic. I inject myself probably a couple of times a day. And, the thought of injecting my penis does not really make me feel warm all over, okay? And besides, it's similar to the medicines, I think, that run the oral medications. And so I don't know how long that would work. It depends on, how far you are gone again. They may stop working after a while. But suppositories, that is even less attractive. You're putting a little suppository in your penis, and that is supposed to work as well. I don't like either one of those. But whoa, what fun. Vacuum pumps. These work for some people. They don't work for others. And I guess when you get in the mood and your partner gets in the mood, it's just really great to go out and use that vacuum pump and see if it will work, and then put a tension ring on it. And there's all sorts of tension rings for sale on the marketplace as well. But again, if the medicine isn't working for you anymore, if you're that far gone, these tension rings aren't going to work very good, and the vacuum pump probably isn't going to work very good either. And so that leaves you with the implants, and the implants are a surgical procedure. Two types of implants right now. There's the inflatable implant, and there's the a little bit more rigid implant that can bend, okay? But it's not inflatable, so it bends. The inflatable implants have basically a reservoir that is planted in you, and a little pump, and when you want to have sexual relations, you pump that pump, and it releases fluid from the reservoir, and it pulls out, it inflates the bags that have been inflated in your penis, and that's the way you get an erection. So these things work even if you've had prostate surgery, and there's no way, just because of your the way you're physically built anymore, and can't get an erection. The implants will enable you to get an erection. So that's kind of the last stage, and some people hop to that stage because they really don't think that the injections or the suppositories or the pumps are going to do much good, and they're probably right if they're that far gone once the medications stop working. Like I say, it is surgery. It requires it's day surgery usually, so you're there and then you're released, but it does require some time to recover. And if you want to know more about this one, go to Pareto Urology, ParetoUrology.com. All right, and I've got the website there, and he has got, he kind of pioneered these things, and he's got all sorts of information out there about implants, penile implants, or they call them penile prostheses. But so there's no reason that you really need to suffer with this. Now, Medicare will pay for the implants. I don't know that other insurance will, so it depends on what your age is. And Medicare does not pay, as far as I know, for the oral medications like Viagra and stuff like that, but maybe your regular insurance will, depending on your age. But, the statistics are that 70% of men over 70 have problems in this area. And so there's no reason to have problems in this area because it can be fixed. These implants do work, and the satisfaction rate with them is pretty good. And so that's something to look into. So Paul Perito, Dr. Paul Perito, has all sorts of information out there. He has done like 8,000 of these things, and whether you just use his site to find out more information so you can find a doctor nearby. He actually happens to be down in Florida, and so it may not be nearby to you, but there's probably a clinic if you're in a city or something. There's probably a clinic that is doing these things, and I would actually get a clinic that does quite a few of them. When they do these, there's two types of surgeries that they can do. They can either cut your scrotum and put these in, implant the devices, or they can do a lower abdominal cut. And Pareto does the lower abdominal cut, and he champions that, basically saying that's the best way to do it. And I don't know which way is the best way to do it, but Pareto has done a lot of it. He even trains a lot of physicians now down in Florida. So I'd go to his website if you're interested in that. Anyway, like I say, there's no reason to suffer with this stuff anymore, because there are options, there are fixes, and hopefully if you need it and the medicine will work for you and it'll work forever. But like I say, the medicine has its drawbacks as well. But regardless of how far gone you are, I mean, there is a option for you. So thanks for watching. Subscribe if you haven't subscribed. If you like the video, give me some comments and give me a thumbs up. And I will see you next time. And I'm not going to guarantee that that's going to be a week, but hopefully it'll be much quicker than what it has this last time. Thank you.